In 1995, Jess Ghannam was one of two psychiatrists for the entire population of the Gaza Strip. Two psychiatrists. For a population of nearly 2 million, many of whom had been internally displaced and traumatized by generations of violent conflict. The contemporary Western medical model of mental health care isn't equipped to address the realities of violence and suffering around the world. The need is just too great, and the tools too limited. I mean, how do you treat PTSD, post-traumatic stress disorder, when there is no post? When you're in a place like Palestine where the trauma is ongoing and intergenerational? And why help someone with their mental health when they're just trying to find food to eat or a safe place to sleep? Jess's work centers around global and community mental health. That means practicing care that is integrated into the community, with an understanding of its cultural and historical background. And it means looking outside of traditional Western methodologies and decolonizing the psychology profession. Anyone, anywhere in the world, deserves to be heard and respected, and to be given the space to heal. That being said, the genocide in Gaza right now is much more immediate and dire than this episode will get into. Jess also works with Kinder USA, an organization whose mission is to improve the lives of Palestinian children and other children in crisis through development and emergency relief. This currently includes food support. If you get something out of today's episode, or if you're just looking for a way to help Palestinian children right now in this moment, please consider donating to them. There will be a link in the description. For now, we're going to look long term. I can't say this is a happy episode, or promise that it'll leave you feeling hopeful, but there is an optimism that shines through Jess's work. We talk about how his own experience with intergenerational trauma as a Palestinian drew him to the mental health profession, how the Western model fails to meet global mental health needs, and what it'll take to do better. As solarpunks, if we want to imagine a brighter future, we have to address the realities of genocide, war, and violent conflict. This includes the multitude of ways violence leaves its lingering mark on communities. Dreaming of a world without war shouldn't be done as idle, wishful thinking. We can't just leave conflict out of our solarpunk stories. We need to put work into imagining realistic progress, and this conversation is a part of that work. You're listening to Solarpunk Now. Join us, and let's imagine a brighter future together.
My name is Jess Ghannam. I'm Palestinian. I usually begin by introducing myself as a Palestinian. But I'm also professionally a professor of psychiatry and global health sciences at the University of California, San Francisco. I use he, him pronouns. Since this is audio, I usually kind of take a minute to just describe myself. I'm a brown man with salt and pepper gray hair and goatee, and I'm wearing glasses right now. My work is been involved for a very long time on looking at basically multi-generational, intergenerational, and chronic trauma in displaced communities throughout the world, but mostly in the Middle East, North Africa, and West Africa, and looking at the impact of war, occupation on children's mental health also. So it's a big category. and attempting to look at the health consequences of those traumatic events on communities, but mostly children, and trying to figure out a way that we can manage that, which I think is kind of an epidemic.
Mm.
So that's kind of the short version of what I do professionally.
Is that something you were always kind of interested in? What did your professional journey look like to getting to where you are?
It's kind of interesting. It's a good question, in terms of a professional journey, because um, I think for a lot of communities of color, for example, and I'm a first generation, so both of my parents were born in Palestine. So I'm the son of refugees. So I think that in that context, I know that at least for me and many of my friends and colleagues who come from similar circumstances, we're kind of born into this environment of politics. You're kind of born as a political being, and I think especially for like Palestinians, we come out of the womb political and understanding kind of the historical context of our experience. And I think that obviously had a profound impact on me and had a profound impact on how I thought about the world, experienced the world, and eventually, and after and during and after going to school, it kind of informed what I wanted to do. Um, as an undergraduate, I focused a lot on, reading about biology and philosophy and psychology. So it was kind of a very broad spectrum of interest that I had, which really did inform a lot of, what I ended up doing. And then in my graduate work, did focus more on kind of psychology, specifically looking at trauma. So I have been kind of a student of trauma, and it both on individuals, but mostly I'm interested in it on communities
Mm.
and its impact. And I've been doing that ever since. And unfortunately, it's the imperative, the kind of imperative of kind of looking at trauma, and what we say kind of in the literature and among my colleagues, we talk about the social determinants of trauma and the social determinants of kind of growing up in a marginalized community, or the social determinants of racism, or the social determinants of growing up, in marginalized, oppressed communities. And that is kind of, can be profoundly traumatic on people. And then what is the impact of that on communities and individuals? So that's maybe just a little bit more detail on some of the work that I do and the things that I think about. But that was my experience growing up, and um, yeah, it really informed how I think about things, really informed the work that I do, and not only as a researcher but as a clinician. So I I, I do research in this area, but I also treat, and I treat communities and individuals who've been exposed to this kind of trauma. So it's kind of all part of this big picture. I didn't have that many detours. I think a lot of people have detours in their lives, right? But this is pretty much what I've been doing most of my professional life.
I think that's a really interesting framing, sort of around trauma and being a student of trauma, which brings up a methodological question that I've sort of been that's been
Mm,
bouncing around in my head. I think, I mean, speaking for myself and probably most of my audience that's based in the U.S. and Europe, we're familiar with a model of care that is very individual. It's, you go in to the clinician's office, you have an hour, they prescribe you something, and I think it's fair to say that's not how treatment works in the majority of the world. That's not how we address
no,
things that are intergenerational, things that are based in the community that have social factors. So I'm really interested to hear like what those methods look like, and how we bring care out of this sort of like one patient on the couch for an hour
right,
model, and actually into like a community and a trauma informed perspective, which I think is very
right.
different.
Actually, such a profound question, and I could talk for hours and hours and hours on that. So if you'll just bear with me, I'll see if I can kind of cover all of the different bases on that, because that's really, that question is like what I spend my entire professional life thinking about, engaging in. And that model, which is a Western European white model of treatment, where an individual has a symptom or has some distress, and then they call their shrink, their local shrink, and they get involved in individualized psychotherapy or some kind of counseling, 50 minutes, 45 minutes once a week. That model is so woefully inadequate at so many different levels, just in terms of addressing the epidemic of trauma and its impact on the world right now. And that model, grew out of, kind of the consequences of what happened in Europe after World War II, and then the transatlantic transition of European psychology and psychiatry to the United States. And it kind of intermixes with capitalism and kind of this Western settler mentality, American settler mentality of individual growth, do what's best for you. It's kind of a very self-indulgent, and I might even use the word kind of self-involved and narcissistic kind of view of distress. And I can say pretty comfortably that in looking at the inadequacy of that particular approach, just look at from a resource perspective, like supply and demand. Like, I'm doing this podcast from the San Francisco Bay Area, where we have some of the largest concentration of shrinks, mental health professionals in the world. And if you were to call your insurance company or try to get an appointment today in the Bay Area, you wouldn't be able to find somebody. And that's in something that's really economically, so far ahead of most places on the planet right now. And even in the Bay Area, you can't connect with anybody. So the kind of supply and demand issue of individualized treatment, and I'm talking about people who have resources, who have money, who have insurance. We're not even talking about people who don't have the resources. So the model, on the one hand, just being kind of narrow and in some ways self-indulgent, which is fine for some folks and can be very helpful. But as I said, we're really talking about an epidemic of need and an epidemic of distress in terms of, the amount of trauma that's occurring globally right now. And so the idea that we can address it on an individual one-on-one basis between a clinician and a person who's suffering, there's no way to make that model work. Right. It just doesn't work. So, we have to, I think, radically reconfigure our understanding of what trauma is, and radically reconfigure about how we think about intervention, radically reconfigure how we provide this level of care. It's a systemic problem. And there's so many different problems in the system that we have here in the States, or I think the Western model, both at the level of the kind of theory of change, but also like the system of providing care, right? Even, and we probably won't have time to talk about this, but the concept of a single payer system, for example, is one way to think about like overcoming some of these problems. But even in the world where there are single payer systems, like in the UK and parts of Europe and in Canada, there are still, it relies primarily on this individual model of psychotherapy, right? You go see a clinician one-on-one, and there's just no way you can keep up with the demand, even in a single payer system. So That's the short answer to your question about the model's not working. Our understanding of mental health struggles and what causes them, and then how to intervene, it's not working. That's part of the reason we have a crisis, I believe, right now. And so, like, um, I'm really one of those individuals who really believes we have to completely transform our understanding and then the models that we use to provide, you know, the care that people really not just need but really deserve.
Right, right. I like that framing. Okay, so there's like a bunch of directions I want to go here. This is a tangent, but I would love if we could address it really quickly.
Sure.
I'm actually looking at going into a master's right now to become a counselor, and probably, some of my audience is in the field or wanting to get in the field. So I'm really grateful for perspectives like yours, where we are reconsidering the model of treatment and how to actually give that to everyone who deserves it, because people deserve it. It's not a privilege to have
Mm-hmm.
have support and feel seen and understood. So I'm sure you've really wrestled with the question that I'm kind of wrestling with now, which is like, how am I going to actually make a difference? Like, how am I in getting the credential to like be allowed to see people
Right.
one on one? How do I have a broader impact? How do I be part of that change?
Yeah, I wrestle with that question every single day. Um, and I do a lot of training, I do a lot of lecturing. And I would say that that question is probably at the heart of, especially nowadays, trying to engage with people who are interested in going into this field, which is a great field, by the way. It's a fantastic kind of life and profession to have. It really is. But yet, you have to go into it with your eyes wide open
Mm-hmm.
in a sense, because if you don't do a really, what I would call a deep dive and self reflection, and I'm going to say something which is going to lead to a big discussion, I know, but you have to go through your own self decolonizing
Mm.
process. Um, if you don't do that, then you just kind of go into it within a system that is kind of already pretty dysfunctional. And then you go through the traditional training and come out on the other end kind of unwittingly or maybe wittingly embracing the very model that is contributing to the difficulties that we're having right now. So I say that for individuals going into the field right now or thinking about it, there's a lot of work that you can do to kind of help prepare yourself to not be complicit in a model that is just not working. And part of it is having a broad understanding of human behavior that goes outside of traditional kind of ways that we teach it nowadays, understanding the impact. I mean, just to be very blunt about it, the impact of economic disparities, um, the impact of racism, the impact of all of these systematic and systemic forms of oppression that occur, that those things exist, that they impact communities and individuals. And then that really has to inform, I believe, your approach to being a clinician and how you want to take this on. And even if you're just going to do individual therapy, for example, you have to be ready to take on like what it means to work with individuals, from really marginalized and oppressed communities. Because if you're not aware of these systemic and systematic, um, structures, including power, then you end up recreating the very dynamic that could contribute to the individual and the communities that you're working with already experiencing distress.
Mm.
So there's a lot of individual work that I think goes into becoming a clinician or a therapist or a counselor, be doing in the mental health field. It requires a lot of work. And that's why I use the word decolonizing, because mentally decolonizing, because, you know, the intention to want to help people is great, but there's, that's the first step. But all the other steps, I think, like taking on like your own privilege, right? Your own, what we call, and I'm sure your audience understands this, your own positionality when you go into a room with somebody or go into an kind of when you're kind of relating to people and trying to be helpful. If you're not deeply aware of your own positionality and where you fit in the hierarchy of power and the hierarchy of class and the hierarchy of, all these systems, you might unwittingly kind of contribute, as I said, contribute to the very difficulties that your client is having. So that's my free piece of advice. It's really hard work. It's really hard work, and you have to do a lot of work on that. And, our training institutions don't really prepare you for that. They don't have you read anti-racist stuff or decolonizing work. You read the more traditional, literature, which is, not that interesting, frankly. But that's, I've been in this for a minute, so, I could say that. But, it's such I mean, understanding human behavior is so phenomenally interesting and so phenomenally compelling that we when we train folks, when we train people, we kind of make it less interesting, unfortunately. So that it's like a big, I'm kind of pleading with schools and with people to really take on this kind of perspective that it's so interesting, it's so complicated, and we just need to like lean into that a little bit rather than shy away from it.
Absolutely. I really appreciate that answer. Thank you so much for indulging my little career advice question.
It's not that little.
It's not.
It's really not. It's like it's really one of these core questions that's the heart of the matter, to be
mhm.
honest.
So I don't want to wait any longer before getting into talking about some of your work. Actual on the ground projects that you've been involved with. You've worked in a lot of different places, but I think today I really want to focus on your work in Palestine
Hmm.
and community mental health treatment in Gaza. Maybe we should start with like a timeline of when you were there. This was before the current ongoing war that's happening right now.
Right,
But I'm not
right.
totally clear. So
Yeah.
a timeline of that, what sort of like objectives you're looking at, either in terms of your research goals or your treatment goals, and what it was like to be one of what, like two psychiatrists for millions of people.
Yeah, it's a I think a good entry point into this discussion is just like because I've been going to Gaza for like 25 years,
Mm,
okay? So like people are interested now in Gaza finally because of what has happened since October 7th, right? But really the devastation and the difficulties and the challenges for Palestinians, and by the way, not just in Gaza, but in the West Bank, Jerusalem,
mm-hmm.
and beyond, have been going on, for 75, 76 years, and in some cases longer. So I know that people get really focused on October 7th, but in reality, this is something that's been going on for generations and generations.
Yeah.
And so, but the first time I did go to Gaza, which was, like 1995, 1996, um, it was just transformative in a sense. And you alluded to how many psychiatrists, in the Gaza Strip. I remember going there and saying to the taxi driver at the time, well, take me to your mental health facility. I want to meet everybody and I want to get to know the system. I mean, and, this taxi driver just started laughing like uncontrollably at me. He was a local Palestinian, driver. But he wouldn't tell me why he was laughing uncontrollably. He was just like, he couldn't stop. In fact, he was laughing so much he was crying. So
Mm.
anyways, he says, okay, I'll take you. So he takes me, we're going through the streets of Gaza at the time, and he takes me to this really nice home. He says, here's your mental health system in Gaza. And it was the home of a psychiatrist, Dr. Yed Sarash, who's passed away recently. And at the time, he was the only psychiatrist in Gaza for, 1.7, 1.8 million Palestinians living
Wow.
there at the time. And I just remember reflecting on that, what we talked about at the beginning, like in San Francisco, we have like 10 shrinks for every person. And here we have here we have one psychiatrist for 1.7, 1.8 million people, right? So the enormity of the resource issue hit me like a ton of bricks, right? Hit me. So that was like one element of it. And then as I began to kind of think about and go there consistently and kind of meet with the community and kind of get a sense of things there, these major constructs and observations just like, as I said, really just radically transformed me because, on the resource issue, there's just no way that you're able to train the number of psychiatrists, psychologists, and mental health professionals to do one-on-one treatment. Just not in the cards. So Dr. Saraj and his colleagues and I developed this community mental health training program and model for just starting the process, which means like training people in techniques and methods of community mental health, which means like instead of just embracing a one-on-one model, you think about engaging with the community or communities that are at risk.
Mm.
And then you don't train necessarily just psychologists or psychiatrists, but we were training physicians, nurses, social workers, teachers in these principles so that, they could go into it in whatever setting they were at because, as a teacher, it would be important to know community mental health principles because many of your kids are really struggling, as I found out. So we started that. It's developed this amazing training program and model. It's all been destroyed, by the way, since October 7th.
Mm.
But the model and the way of thinking remains and it will be rebuilt. So that's like on the level of like resources. But on the other hand, the other thing that I became acutely aware of, even, and this was part of my own experience just individually as a Palestinian, but I saw it in real life on the ground in Gaza, was just the profound nature of the impact of settler colonialism, of occupation and war on communities. And so looking at, especially in the Palestinian context, we're really looking at generational trauma because I was meeting with people and children who were the third and fourth generation of individuals who were originally displaced in 1947 and experienced this massive trauma of being forcibly removed from their homes and villages in 1948, and then again in 1967, and then in the Gaza context, a total blockade in 2005, and then since 2005, 5 wars. And so it's a kind of trauma that transcends the way we teach it nowadays. We teach this idea of PTSD, right?
Mm-hmm.
You have a singular traumatic event. Maybe you develop symptoms, maybe you don't, and then you can do something. But what do you do in communities where the trauma never stops?
There's no P.
No, there's no post. It's just chronic, debilitating, unending, ongoing traumatic exposure. And so I, and I believe all of us have to rethink this concept of trauma and trauma-informed care, because at least for Palestinians, especially those in Gaza, and especially now, have endured a kind of trauma that is just, um, for lack of a better word, catastrophic and unending, catastrophic and chronic. So then, how do you think about intervening? How do you think about helping? How do you think about, the nature of trauma and its impact? It all just, and I said this at the beginning, you really have to radically reconfigure. And that's really what I've been spending the last number of years really thinking about.
So I'd love to hear more. I think maybe we need to back up just a little bit to hear your definition of trauma, how you've been rethinking it. I'm curious to hear sort of what questions you've been wrestling with and what
Yeah.
you've been able to realize and come to through your work on the ground.
Yeah. I mean, I'll take a step back and like talk about the African American experience for a minute here, okay? Because that's another profound example of what I'm trying to talk about. Like, if you think about what it's like for the African American community here in the States, right? And if a African American individual comes into your office and they're feeling, let's say, quote, stressed or depressed or anxious, you as the clinician, if you don't understand the African American experience in the context of 400 years of slavery and oppression and racism, you're going to you're going to do a great disservice to this individual, because when that individual comes into your office, they're not coming just as an individual who is
Mm-hmm.
stressed at work or is having difficulties in relationships. They're coming into it with a kind of generational trauma that has been internalized and imposed on them that is profound, right? And this is basically what I was trying to talk about at the very beginning. And like, if you don't even have any awareness about the impact of, 400 years of slavery and its impact on the African American community, that generational trauma, and the impact of racism on on communities and individual, which has profound health consequences. We know this from so much research and literature that, basically doesn't matter if your income, doesn't matter what neighborhood you're in, if you're African American or come from a marginalized community, your health outcomes in terms of chronic health and even mental health are going to be severely limited and degraded because of those structural and historical inequities, right?
Right.
So I think that's a really kind of profound example, in thinking about Palestine, because, in the Palestinian context, we're talking about 100 years of colonization, right? If you go back to the British in 1918, but if you go to the current context of the Israeli settler colonial project that, began before 1948, but kind of accelerated in 1948, where 800,000 Palestinians were forcibly removed from their homes, 500 villages were depopulated. That profound trauma on Palestinians has and continues to affect every single generation since.
Mm-hmm.
So when I go to Gaza, when I was going to Gaza, and this is obviously before October 7th, it that that appreciation for and understanding of helped me profoundly think more critically about, well, what can we, it's back to your question, what can we do? How can we help? And this is like why we teach people today, like confronting racism and breaking down the barriers of systemic racism within structures of power, within the medical establishment or within the healthcare delivery system, has to be uh, part of the question and part of the solution. So, and the same goes for Palestine and for Palestinians. And I'll go quickly to the end and then come back, which is how, and Palestinians in Gaza have been telling me this for years, and in the West Bank and in Jerusalem, and it's something that I can clearly connect with. It's like, how can you really treat and help people with their trauma when they're still under occupation,
Yeah.
when they're still being oppressed? It's like, wow. So it's like that's such a profound thing to think about and to say, and it really is the heart of what we're trying to talk about today. It's just like, well, if this African American person comes into my office and they're part of all of these racialized, racist structures that are contributing to what they're experiencing in the world, and we all as people and as mental health and providers don't work to become anti-racist and create anti-racism kind of approaches to our work, then we're just contributing to the problem. And in the Palestinian context, it's the same. If we don't contribute and create, a confrontation of anti-oppressive work against the occupation in Palestine, against the settler colonial project in Palestine, then we will unwittingly contribute to it. So and again, I mean, that's the simple answer. How it looks on the ground, um, you know, just a couple of small examples. I mean, I know in the Palestinian context, one of the things that I was really struck by is the impact of this generational trauma on children, and especially kids in Gaza, right? Because there's been, the Israelis have blockaded Gaza since 2005, which means that nothing goes in and out of Gaza without
Mm-hmm.
Israeli military control. Israel also imposes calorie restrictions on Palestinians in Gaza. So there's only so much food, water, and medicine that they let in. So there's like this ratcheting up of this oppressive kind of settler colonial mindset on Palestinians in Gaza, which is really debilitating and really oppressive and really traumatic, adding to the already traumatic history, right? So what I noticed in children in Gaza, especially after 2005, is that they were really struggling with this basic fundamental thing that all children do. And this is really interesting to me because I've been to globally, I've been to a lot of different places, and this is true kind of transculturally, everywhere in the world. Children have this one amazing, unique, and beautiful capacity, no matter where they are in the world, and that's the capacity to play,
Mm.
right? Children
Yeah.
play. And that's evolutionarily important. That's psychologically important. It's physically important. I would say, it's the fundamental aspect for child development, emotional, cognitive, physical development. But I noticed that Palestinian children, for lots of different reasons, were having a difficult time engaging in just regular, normal, everyday play. So what we decided to do is develop these therapeutic playgrounds. And it sounds fancy, right? But really, all it is creating spaces for children to play freely. You know, they can do physical play, they can do like art therapy, they can do music therapy, they can do drama therapy, but all these different spaces that we would bring kids to allow them to, for lack of a better word and phrase, to just be children and to engage in play that would allow the natural, normal unfolding of what it means to be a child to happen. And it was like wildly successful. It really was. It was really fantastic to see the transformation in children when given the opportunity for these spaces and an opportunity to play happen, how they just like flourished. And then we would bring the parents in too. And then the parents, we would just give them like educational, a chance to talk about their stress and to talk about like child development, talk about like what traumatic stress looks like in children and be able to engage with them. So this is like an example of a community intervention. It's not bringing a kid in and putting them on a couch and saying free associate, which is sounds silly, but it's kind of ridiculous thinking about that in the Palestinian context, but really thinking about like at the level of the community, working with larger numbers of people at the level of community addresses some of those things that we talked about, which is like, well, if one-on-one stuff is just not possible and you want to work with the community, then this idea of the therapeutic playground is like one of many possibilities in terms of, how to think about this different way of approaching, generational stress. Because you're helping the parents, right? You're helping the children. And, and then there's the larger problem, like, and we all feel this, especially now since October 7th, there's like this global solidarity movement, which is, well, we need to figure out globally as a world community how we can stop the aggression of the settler colonial project and the occupation in Palestine. Because ultimately, without that, it's going to limit how much we can do. Because unless Palestinians are free, unless people in Sudan are free, unless people in Yemen are free, and unless here in the States we kind of fight against all the racist structures that are occurring in all of the communities, marginalized communities, then none of us will actually be free. And then it really limits what we can do in terms of helping people. I think that's probably kind of the outline of thinking about like this new model and new method of kind of intervening and thinking about stress. I don't know if that made sense.
Oh, totally makes sense. Yeah,
Oh, okay.
it sounds like a really beautiful project. And you mentioned at some point, since October 7th, this has pretty much been destroyed. I'm wondering what it's been like for you reckoning with that. What you're kind of working on now. Are there still like remnants of it? Are you going to go back? Is there
Yeah,
where
yeah.
where are you at?
Well, I think I'm at the same place most of us are at, who are like really connected to what's happening in Palestine and specifically in Gaza right now. I mean, like, we're all devastated. I mean, we're because of like social media, this is like, I think, the first time in human history that all of us in the world community are bearing witness to a genocide right before our eyes, right?
Yeah.
It's not hidden. And so like that is deeply affecting all of us. And it's, that if you want to talk about global trauma, I mean, there's the global trauma, obviously, of what's happening to Palestinians in Gaza, which is, catastrophic. But then I think about the secondary trauma, which is another concept of like the global solidarity community who feel just devastated by the lack of international abilities to stop a genocide that is happening right before our eyes.
Yeah. Yeah.
And if you happen to be an American citizen, you have an added burden that your government is actively encouraging and complicit in the genocide. And that's creating for most of us like an unbearable sense of distress, because most people that I work with, and I think most of the global community, believes that genocide is a bad thing and we should stop it. So there's that sense of like powerlessness or lack of ability to do anything about it. So that's really, I think, challenging to say the least right now. But I think that can't stop you from engaging. And that's really what I always tell my colleagues and tell people that I work with is that checking out and getting kind of paralyzed to do anything is not helpful for you as an individual. It's not helpful for the community, and it's not helpful for Palestinians or any people who are being subjected to this, whether it's Sudan, Yemen, Myanmar, Central America, indigenous communities. So it's incumbent on all of us that we, despite the grief and the stress that we're feeling, and this goes especially, it goes for me, this is what I think about every day, that we stay activated and engaged. And so your question specifically is, what am I doing? And, I'm not thinking about what are we going to do to rebuild the therapeutic playgrounds. I mean, we'll get there eventually, but the immediate need right now is that, 500,000 Palestinians in Gaza are starving to death.
Yeah.
So the real issue right now is like doing whatever it takes to just get food in and to create an opportunity for ceasefire, because you have to have a ceasefire, you have to have food, water, and medicine, and really that's all I'm thinking about right now is like food, water, and medicine, and a ceasefire. Once that's in place, then yeah, I mean we're all thinking about rebuilding and what we can do to help rebuild healthcare infrastructure and help communities recover from this like devastating 9-10 months now. So there's this old theory, which if you go to school as a counselor you should read about it, or if you've done like undergraduate work, Maslow's hierarchy of needs, right? So like if you don't feed people, how can you do psychotherapy, right? If they don't feel safe and they don't have the opportunity for basic needs to be met, the idea of doing counseling or therapy is ridiculous. So it's like, let's deal with the immediate needs first. Let's get a ceasefire. Let's stop the famine. Let's get people housed. Let's do the basics first. So that's really what I try to focus on most.
That makes sense. Yeah, there's just so many immediate needs in every direction. I wanna ask about hope. I feel like the concept of hope
Yeah.
is kind of kind of difficult right now. I mean,
Mm,
seeing all these devastating crises that are currently happening and ones that are like looming on the horizon, is
right.
is hope something that you hold on to? Is it important to you? Do you have a critique of it? How are you holding or not holding space for hope
Mm.
right now?
Wow, I really love that question. Uh, you might be surprised to hear that I'm actually a very hopeful and optimistic person after this long discussion, right? You might think, wow. But actually, I'm a very optimistic and hopeful person, but I do have a critique of hope.
All
And
right.
I think cheesy hope and cheesy optimism, and which really what I'm saying is like hope and optimism disconnected from reality is not good. I mean, like if people say, "Oh, it'll all just work out, everything will just be fine." No, that's not how it works. So, hope in the context of like global solidarity and engagement, what makes me feel hopeful is seeing like on campuses in the United States and in Europe and other places, seeing student encampments in solidarity with what's happening in Palestine. The millions of people on the streets who are protesting against genocide, and against the US government and against the Israeli government for committing and being complicit with genocide. That really makes me feel hopeful. It makes me feel hopeful that there are tens of millions of people globally who are seeing what's happening and are fed up and are fighting against the kind of world order that allows this kind of genocide to occur in real time. So that's amazing to me. That gives me hope. That makes me feel optimistic that there's a generation of people that are like who are undergraduates or graduate students now, that generation who are ready to devote themselves to this. I get really optimistic and hopeful about it. Now, it's coming on the it's coming at a grave cost of life to Palestinians in Gaza, obviously.
Mm-hmm.
So that's the contrast, that's the contradiction that's in front of us right now. But I mean, but I remain kind of hopeful and optimistic by what I see.
Thank you for sharing that. Yeah,
Yeah,
it's I agree that there's a certain kind of hope that assumes salvation is going to come from somewhere, but the hope is that we're going to, we're going to bring about the change ourselves. And I think that
exactly.
it is really
Collectively,
yeah. And it's
collectively,
important to
yeah.
remember like we have a dampening effect in our media and our government, but the majority of Americans are not okay at all with this genocide. We're not okay with what's happening. And there's that sense of global solidarity. It's just really heartening to see and see that people are seeing through the bullshit that
Right.
the New York Times or whoever is putting out.
Yeah, yeah, and that's really the optimism. I mean, my optimism doesn't come from watching a debate between two old white guys who are in cognitive decline. That doesn't give me hope.
Yeah.
I mean, or the complicity of of most of the print and broadcast media who have, you know, who aren't even reporting on what's happening in Gaza. And I don't know when this podcast will get broadcast, but just, just today, the Israeli military murdered 71 Palestinian civilians, in Gaza in the middle of a densely populated area. And, the media didn't cover it,
Yeah.
and so that's why, and you said it really nicely. It's just like, we don't look for optimism and hope from government leaders or media. We look at it from what we see in our communities and what's happening in global solidarity. And when I see that, it's so awesome. It really is, to see what people are doing.
Yeah. That's really something I aim to highlight with this show. Like
Hmm.
things are happening. There's networks you can tap into. There are people who care all around us, and I really want to highlight how much of that in the world there is despite everything. So I've avoided talking about solar punk so far because it feels a little superfluous given the context of
No,
our
don't.
conversation. But
No, don't.
are you familiar with solar punk and sort of related utopian literatures?
Yeah,
I'm curious,
yeah.
what your perspective on solar punk
Hmm.
is, how you would position yourself. Do you think that, is there a problem with the way utopian literature sort of addresses, all of
Hmm.
the war and displacement and intergenerational traumas that, you know, the things that presumably we're going to resolve when getting to a utopia?
Yeah, that's a what I would call a 10 espresso discussion, right? That's a long discussion. So I'll give you again the short version. The short version is I I just, it's just like I have a different kind of analysis about the utopia literature and utopian literature in general, which is, and this just comes from like my own experience of human behavior and maybe the way I think about utopia and utopian kind of communities is a little different because I don't think these things are going to go away.
Mm,
That's, and, whether it's war, um, economic asymmetries, race, occupations, it's not so much that I envision a world necessarily, although it would be great, where that is gone forever, but rather I think what I think about when I think about utopian kind of structures or collectives, if you will, is that we create these spaces that when we face difficulties, we as human beings are all committed to solving the problem at least,
mm,
right?
mm-hmm.
And so that to me is just a slightly more nuanced thing because the utopian images that I have are not the absence of something, but rather like a process of like respect and dignity and humility and, you know, how we as individuals and communities kind of collectively come together to solve problems. Not that the problems go away, because I don't believe they ever will, just by virtue of us being human beings, but that we can all collectively kind of agree that, yeah, shit happens, but let's at least be all committed to like ways in which that we can address it and work to solving them. So that's just a little nuance there.
Just
That
one
makes any
espresso.
sense. Yeah, that's the one espresso analysis.
Well, do you have are there utopias, books or movies or something more abstract that really speak to you, or do you have a vision of a world floating around in your own head that you'd like to share?
Um,
And I guess this would lead into the last question. So, what does utopia look like to you?
yeah, I kind of was trying to get at it. I would like to see a world where all of us are working to decolonize our minds together. Yeah, I mean, in the ideal scenario, I mean, the idea that we would all be engaged in a process of like equity, equality, dignity, and respect, because that's really, those are the constructs that I'm really committed to. And again, not that we ever get there completely, but that we as community, as a world community, kind of come together and agree like those are good principles and that we're going to work toward them, and that we are committed all to like decolonizing ourselves mentally so that we can work together on this. It kind of looks that way to
Hmm.
me. In the end, now getting there means, kind of doing what we're doing now, like fighting for justice and equity and equality, and like even more concretely, like, kind of the anti-racist kind of approach to thinking about healthcare, because that's the space that I work in. And, you know, equal access to healthcare, equal outcomes. Like you can have the access, but you still don't have, positive outcomes. So it's access and outcomes. So I wish there was a book or a movie that kind of articulated that vision really beautifully. But, it's funny, like the movie, the kind of, no, I can't say that there is a single book or movie that kind of captures it. I mean, like one of my go-to books has always been Frantz Fanon's Wretched of the Earth, right?
Mm-hmm.
Because I think that as a foundational text helps me think about like where I would like to see us all going. Or Black Skin, White Mask, Wretched of the Earth. I mean, just like that's the way I kind of think about it in terms of like the processes I'd like to see us globally kind of get on board with and thinking about power and yeah. So I'm sorry I don't have a great book or movie recommendation.
That's all right. It
But
just means someone listening needs to go write one.
yeah.
Solarpunk Now is written, hosted, and produced by me, Luca Dowell. The Solarpunk theme song is by Red Keener. My guest today was Jess Ghannam, clinical professor of psychiatry and global health sciences at the University of California, San Francisco. If you're looking for a place to donate right now to help children in Gaza, he recommends Kinder USA at kinderusa.org. You can follow me on Twitter at SolarpunkCast, Mastodon at SolarpunkCast at Spore.social, and visit SolarpunkCast.net for show notes and to support the show with a donation. And remember, the realization of any vision requires action. I strongly encourage you to get involved with organizations whose goals align with the brighter future you want to see. Analysis is important, but we have to back it up with collective practice. Keep dreaming big, and keep up the good work.